Bernadette Subcheck, and here we are during COVID-19, and we are doing our video lab session. We're going to go over today what we expect for you for the musculoskeletal system. And actually, this is just more for your information, because if you're a CRNA student, you don't have to test out on these techniques. These are just things that are good to know in your practice if you're working in pain management or any kind of ortho clinic. It's just some good information to have. So grab a bowl of popcorn, and here we go. So first thing we want to do on the musculoskeletal system is we want to palpate Alex's jaw to see if he has good range of motion of his jaw. So open and close your mouth. Open and close, good. And we're checking, keep opening and closing, Alex. We're checking to make sure we don't feel any popping or any looseness of his jaw, and I do not feel that. So we're feeling for tympanic membrane issues. So then what I want you to do is I want you to take your chin and I want you to place it all the way down on your chest and then go all the way to the back. Put your head all the way back. Very good. Now go ahead and come midline to normal and then turn side to side. Excellent. And then I want you to take there you go. And then on the other side, take your ear and put it to your shoulder. Good. Excellent. So everything looks good with that. Then we want to have you do all the 6 cardinal ranges of motion of the shoulder. So let's go ahead and have you stand up, Alex. Go ahead and stand up. Stand up. You're fine right there. So I want you to go ahead and extend your arms as far as you can, and then hyperextend them as far as you can. Bring them out to the side as much as you can. So that is abduction, and anytime you bring anything together, it is called adduction. So we'll have him bring his arms together midline. Very good. Excellent. So let's do this again. This is abduction, abduction, and this is adduction. Excellent. And then there's circumduction. So we'll check to make sure that he's able to rotate like a swimmer would. Excellent. It looks like you're doing fabulous. And then go like this. Excellent. That's a little bit more than 6, but those are the cardinal ranges of motion of the shoulder. Let's go ahead and have you hop up here. And it looks like he has full range of motion active. So that's what we would have the patient do. So Neers and Hawkins are signs of impingement syndrome. The Neers test is simply where we'll ask our patient, we're going to put pressure and right here on the acromion process, and we're going to have Alex flex his arm up. So bring your arm out straight and lift it up. Any pain with that? Do you have any pain? No. Okay, and then I would do it on the same on the low and have him lower it, and then we'll have him flex as I'm putting pressure on his scapula. Go ahead and extend your arm up. Exactly, perfect. Okay, you can go ahead and release. So that is Neer's sign, and what you're trying to do with impingement syndrome, and I explained really good in the lecture about impingement syndrome, and it is good to know for the test, hint, hint, what impingement syndrome is, but you have a series of muscles in the rotator cuff that make up the rotator cuff, and what happens sometimes is something unusual about the shoulder that is different than any other part of the body is you have muscles that are surrounded by bone. And anytime there's any inflammation in any of the muscles of the rotator cuff, it can cause pain and discomfort. And that's what we're basically trying to stimulate here. So now we have the Hawkins sign. I like to call it the Hawkins sign. I remember it because I think of it whenever the position that you take for it, like a chicken hawk. So Alex, I want you to flex right here. Bring your arm out like this, like you're going to pat your belly. And what I'm going to do is I'm going to put pressure downward on his humerus and outward. So now you need to try and resist. So try not to have me do this. So you try to hold still. Okay, does that cause any pain? No. Right up here? No? No? Let's do it on the other side. Same thing. On the other side, I'm going to put pressure down and up. Very good. And then vice versa. Okay, and that doesn't cause any pain?
No.
Okay, so that's Hawkins' sign. And then let's go ahead and have you do the crossover test. The crossover test is I want you to take your arm and I want you to try and touch your shoulder blade. Very good. Now go ahead and let it down. And then same thing on the other side. This tests for a rotator cuff tear, and it's called the crossover test. People with torn or partially torn rotator cuffs may not be able to do this. Bring your arms out like this, and I'm going to try and push down now, and as you can see, he doesn't drop his arm. That's called the drop arm test. Now I want you, what you would do for the drop arm test is have the patient bring both arms out to the side, and then I'm going to have you slowly lower. Go ahead and bring your arms out to the side. Another way to do it is to put pressure down, and he's obviously not collapsing. Somebody who has a rotator cuff tear, depending on the level of the tear, may not be able to slowly lower or even raise their arm. Or if there's any pressure put down, their arm just collapses. So that's the drop arm test. Some additional tests that aren't on your rubric, and again, CRNAs don't have to test out on the musculoskeletal system, but FMPs would. I'm going to have you do the empty can test. So I want you to pretend like you're holding 2 cans of soda. There you go. And then bring your arms out like this and try to empty them. Empty them. Like this. No, other way, honey. There you go. Does that cause any pain of your shoulders? No. Now bring your arms out like this, like you're holding those cans again. Now hold them really, really, really tight, and I'm going to put pressure, outward pressure, and you try to resist, okay? Does that cause any pain of your shoulders? Good. So that's another negative test as well. But those are all used to test also for impingement syndrome and problems with the rotator cuff as well. Just a little additional information. So then we're going to have you test the range of motion of your elbows. Your elbows have primarily, so we'll have you do, this is supination. I like to remember supination as I'm asking for my supper. So supination and then pronation. Good. And then flexion and extension. So good. He has full range of motion of his elbows. And then let's go ahead and move on to the wrists. Just palpating his wrists. And what I'd like you to do is flex downward, flex upward, and then a circular motion. Okay, and I don't see any difficulty with that. I'm going to do the Finkelstein test. I want you to take your fists, or take your thumb and put them in your fists like this. And then what I want you to do is slowly flex at the wrist. And this is testing for stiffness of the tendon right here, the brachial tendon. Sometimes gamers, people who overuse their wrists can get pain and tenderness or crepiness in this tendon right here. So, and he obviously doesn't have that, but that's the Finkelstein test. That is all of those signs, and then we should also palpate. This is to test for a fracture of the navicular bone. Palpating right here would indicate if that causes snuff box tenderness, then that would indicate that there could be a fracture of one of the hand bones, and he does not have any tenderness there. So that's what the snuff box tenderness is palpating there if you suspect that there's a fracture in one of the bones of the hand. Okay, let's go ahead and move on to Tyndall and Phelan's sign. And so Phelan's sign, we will ask our patient to bring his arms together in a praying position. And yep, perfect. Now do that for about 30 seconds. We're not going to make our actor, our volunteer, do it for a full 30 seconds. But I am going to show you what we would ask him. Alex, do you have any tingling, numbness, or pain in your fingers when you do this?
What does tingling mean?
Numbness, like feeling of pins and needles. Do you have any numbness or weird feeling of your fingers when you do this?
No, not really. Yeah.
Okay, good. So that's a negative Phelan sign. Okay, and what is this testing for? This is testing for carpal tunnel syndrome. So for the test, it's good to know what all of these tests are trying to elicit. So then finally, what carpal tunnel syndrome is it's median nerve tenderness. The median nerve runs right along here. And so Tyndall's sign is where I take my middle finger and I tap along that medial nerve, trying to provoke pain. A positive Tyndall sign is if Alex would complain of pain or numbness or tingling that radiates along his palm into his fingers. Do you have any of that? Any numbness or tingling?
Nope.
Okay, Alex, good. So there's that. And then finally, we're gonna take a look at Alex's spine. So Alex, this is the proper way to do this. Well, this one doesn't want to come out. So go ahead and step down. We have faulty equipment in the lab. Shh. Go ahead and hop down here. All right. So the proper way to look at someone's spine, especially if they're a youngster and you're trying to look, youngster, I sound like a grandma. If you're especially trying to look for a bend over test to make sure they don't have scoliosis, is you want to inspect the spine. So Alex, turn around, please. And I'm going to lift up his shirt. And I'm going to take a look. You can just stand up straight. And we're going to take a look for any unevenness. We're going to look at the level of his shoulder blades, or to make sure that there's no issues with his scapula, to make sure they're not uneven. We're going to take a look. It's kind of difficult in people with baggy clothes, but we're going to take a look at the level of Alex's shoulders to make sure that his shoulders are nice and even. If they're not, that could be an issue with him having scoliosis. We're going to ask Alex to put his legs together. He has already done so. We're going to ask him to bring his arms out straight. Bring your arms out straight. No, in front of you, hon. In front of you. There you go. Straight like that, and then bend down until it's no longer comfortable. No, honey, bend down. Bend down at your waist. Bend down at your waist. Bend down like this. There you go. Bend down and try to touch your toes. As far down as it'll go. Come here. So what we're doing is we're going to look at his back to make sure that his back is nice and straight. Stay down there, please. Make sure that his back is nice and straight and there's no signs of curvature, which there is not. If you would see somebody with scoliosis, there might be in this area a lump or a bump or a hump if the spine is not straight. I like to look at the side, so I'll have you come over here. No, not you, honey. You just stay still. You come over here. So I like to look at the angle of his spine to make sure that there's no lordosis. Lordosis would be excessive curvature here. Kyphosis would be like a buffalo hump here, and he does not have that. So you can go ahead and go back to your normal position, recorder. Thank you. Let's go ahead and have you hop back up here. Actually, before we do that, let's do some other motions since we're here. I would like you to turn like this to your side, both sides, all the way. Good. All the way this way. Then I want you to laterally go like this, go side to side. There you go. Then off to the other side. Excellent. And then go back as far as you can. Okay, and then bend down and touch your toes. We're just checking the flexibility of his spine. Excellent. You can go and hop back up. All right. Now we're going to go on to the knee exams. So go ahead and lay back, please. We're going to make sure that Alex is nice and comfortable. So these are some of the knee exams that we should be performing. Anytime you look at the knees, make sure that you're comparing them side by side. So I'm glad he wore nice loose pants. We're going to go ahead and inspect the knees, looking at them side by side. You can go ahead and come closer, honey, and focus in on the knees. Everything is nice and even. They look nice and even. There's no enlargement, no swelling, no bruising, or anything like that. So let's start with the bulge sign. With the bulge sign, we're going to palpate down upon the patella, and we're going to try and displace any fluid upward, and we're going to feel for it. I'm sorry, that's ballottement. My bad. I'm confusing it. That is ballottement, where we're actually trying to press down on the knee to feel for effusions and pushing up. Now the bulge sign. So this is ballottement. This is the bulge sign. So people who have a knee effusion or effusion of the knee, you want to stroke one side of their kneecap. And in a positive bulge sign, that will displace fluid off to the other side. So there is no displacement of fluid. I don't see any bump or any fluid displacement on the other side. But people with knee effusions can have this. So with the bulge sign, you just stroke both sides of the knee, looking for displacement of fluid or a fluid wave, and I don't see any. And that checks for knee effusion. So now let's go ahead and have Alex do some of our tests for ACL and PCL damage. Let's go ahead and have you flex to here. So when we have the patient in at least 90 degrees of flexion, we test the anterior and posterior drawer. So visualize with your knee, you have your anterior cruciate ligament, and behind your knee, you have a posterior cruciate ligament, so in the gap of your knee, the bend of your knee. So what we're doing is we're going to put, like as if we were pressing on a drawer, we're going to push down and back, down and back. And we're checking to see if the knee gives at all. What I'm feeling with Alex is normal. He doesn't have any give to the knee. But in somebody who had a problem with ACL or PCL tear or injury, they would have some give of this knee here. And so we would of course do it on both sides. Depending on where it depends if we expected to have an injury on both sides or whether or not the person was just complaining of knee pain on one side. So that's how you do the drawer test. Anterior drawer, posterior drawer, anterior drawer, posterior drawer. That's that. Let's go ahead and look at the varus valgus stress test. So Alex, go ahead and put your leg off to the side here and just hold it steady. So now this is looking at your medial cruciate ligament and your lateral cruciate ligament. And we would be looking for any tears or damage, partial tears to those ligaments. What we would do is have the patient bring his leg out nice and straight, and I would be putting outward pressure and inward pressure. Outward pressure and inward pressure. There is no give, and so there's no concerns about him having a tear of his MCL or his LCL, lateral LCL, MCL, and there's no concerns because he has a nice strong, there's no give. So those are your varus and valgus stress tests. Let's do the Lachman's test. Lachman's test, you just have him very slightly flex. And I'm gonna put downward pressure on his tib fib and upward pressure on his femur, and then vice versa. And that is your Lachman's test. That is also testing your ACL and your PCL. It's putting pressure on those ligaments to see if there's any laxity in them. So that's how you check for that. And then finally, there is the McMurray test. The McMurray test tests for meniscus tear. And in the video that I showed you online, I believe I did in the video that we have that shows this, and also in the lecture that I have, it shows you that basically your meniscus is like two horseshoes put together. Anytime you have a tear or where it's not nice and smooth, things can get locked together, meaning some common symptoms of somebody with a meniscus tear would be the sensation that their knee is locking into place, like they can't straighten it out or they can't bend it. And that's due to wherever the meniscus is getting stuck in between the tibia and the femur and the tib fib. So let's do this here. And this is how we do this. Okay, so we're going to externally rotate and extend, externally rotate and extend, externally rotate and extend, and then we're going to start doing it in a U shape to where we're doing this motion in a U shape. What we're trying to do is trap the meniscus and get it to lock. And obviously Alex does not have a meniscus tear because we're not having any popping or locking at his knee. So we're trying to provoke this. Some people, some orthos I've seen just simply do this type of motion to see if they can get it to lock. I prefer the good old-fashioned test, the McMurray test, trying to provoke it to lock and pop. So anyway, that is that test. Let me see if there's anything else on your knee test out. Bulge line allotment and varus valgus, posterior, and look at that, we are good. Let me see if there's any others. I don't see any others. So that concludes the musculoskeletal test out.